criteria, statistical analysis, etc., without conflicting with the doctrines of our homeopathy. So I would like to add that as we are working towards evidence-based medicines and conducting research in homeopathy to generate evidence, today, as we know that homeopathy is practiced in about 80 countries either as independent or as an complementary or integrated to modern system. The clinical practice is primarily based on traditional wisdom available in the form of materia medica, what we have these drug provings and experiences regarding many decades ago. These are available in the form of textbook and now through various softwares also. Majority of these practices are focused on interpretation of these wisdom that often lacks scientific planning and statistical rigor. We all are very good clinicians. We all used to treat successfully so many cases in our day-to-day practice, but there is one problem that we don't keep proper records of these cases. Though we have heaps and heaps of data, but we are not recording anywhere in a proper manner. Not even how many cases we have treated of which disease condition. No such data is available with us. Though we don't treat disease in man, but we treat man in disease. But during making any policy by the government, this data is very vital. The reason behind this is, number one, we don't have time, and the other and more important reason which applies here, that in our practice, we don't have research culture. So the research output is very limited. As clinicians seldom report their successes. There are three important facets of best practice in clinical research. Number one is research design, then it's conduct and reporting, and number three is how these are relevant to homeopathy. As we see in our IJRS, then more than 70% of our articles uploaded for publication in our journals are rejected. One of the factors for rejection is lack of formal knowledge in conducting and reporting research, along with inadequate exposure of quality research environment in our medical colleges. This is the reason CCRH has initiated one webinar series on research methodology called RISE, that is Research Interaction with the Students, Enrichment, Enhancement, and Encouragement, under our one scheme that is called Linking Research with Education. As in today, we have collaboration with 79 homeopathic medical colleges of India, and in our each webinar, the number of attendees are between 7,000 to 8,000 students and faculties. Also, through collaborative clinical research studies, we got good clinical data on hemophilia, psoriasis, periodontitis, geriatric care, rheumatoid arthritis, pragmatic trial on children, and we have also conducted 25 studies on COVID-19 alone. In my opinion, it's not only what kind of research design we are specifically pursue, but how well we do it, get the real results. A well-planned research design will help ensure that our methodologies meet our research objectives and that we are using the correct type of analysis of our data. We should carefully consider which methods are most appropriate and most suitable for answering the question. Though carefully designed studies, clinical trials, and basic fundamental research, we are able to understand the mechanism of action behind homeopathic remedies, their efficacy, and their safety profiles. Research allows us to demonstrate that homeopathy is not a mere placebo, but a system grounded in scientifically observable phenomena. CCRH is actively engaged in expanding the horizon of research in homeopathy. This rigorous research agenda enhances the effectiveness, personalization, and responsiveness of homeopathic practices to meet the need of patients in this 21st century. Those who are new to CCRH, let me introduce what CCRH is. Under the aegis of Ministry of Ayush, Government of India, CCRH is an apex research organization which undertakes, coordinates, promotes, develops, and disseminates scientific research in the field of homeopathic system of medicine. CCRH is basically engaged in multi-dimensional research activities in different fields, like to start with survey and collection of medicine plant, cultivation of medicinal plant, drug standardization, drug proving, clinical verification, clinical research, clinical validation, literary research, epidemic research, public health program in research mode, and so on. So CCRH undertakes these research studies with the many popular institutes, which throughout India, we are having 34 institutes and units. where we are, other than our clinical services and laboratory facilities, we provide IPD services at some selected centers. So we are also engaged in basic and fundamental research in homeopathy conducted on biological models, that is in vitro and in vivo, and on physicochemical models with collaborations of many National Institute of repute. Research into how homeopathic remedies work, especially at the molecular or quantum level, is gaining traction. Understanding the underlying mechanism through quantum physics, nanomedicine, and biochemistry is bringing a more scientific perspective to homeopathy. Scientists are employing advanced techniques such as genomics, proteomics, and metabolomics to study the effects of homeopathic medicines on biological systems. So these studies are providing valuable insights into the potential therapeutics benefits of homeopathy and helping to bridge the gap between traditional practice and modern scientific understanding. Our vision is to undertake and promote research that contribute towards the development of homeopathic system of medicine globally, especially for the public health. So by embracing scientific research, we are not only enhancing the credibility of homeopathy, but also reaffirming its place in the global healthcare system. In CCRH, we are advancing research methodologies that are aligned with the international standards, ensuring that homeopathy remains relevant in evolving landscape of healthcare. We have taken 335 clinical research studies so far and published more than 4,000 publications in reputed national and international journals. We have developed standard treatment guidelines in homeopathy for 66 clinical conditions. We have also developed standard treatment guidelines app, published 3 clinical research series, also published good clinical practice guideline for clinical trials in homeopathy. We have also developed HCCR, that is Homeopathic Clinical Case Repository, which promote transparent and accurate reporting of clinical cases in homeopathy. So by inculcating a culture of adhering to case reporting guidelines, that will result in evidence-based high quality case reporting. And when we talk what a clinician can do, so a clinician should adhere to the reporting guideline for the STD types to be published. Suppose they want there's a randomized control trial, so they have to follow the consort type of guidelines. If they are in the observational studies, then they have to follow stroke guidelines. If they are doing systemic review, then they have to go for PRISMA guidelines. Study protocols, there are split guidelines. Diagnostic prognostic studies, if they are interested, so they have to follow the STARD line guidelines. For case reports, it's simple care guidelines are there. And for clinical practice guideline, there is AGRI guidelines are there. Qualitative research, if you are doing, so you have to go for SRQR guidelines. If you are doing research on animals or preclinical studies, then we have to go for ARRIVE guidelines, ARRIVE. And this quality improvement studies, if we are doing, then we have to go SQUARE guidelines. And economic evolution you have to go for CHEERS. So there are so many things. If you are able to go in the internet, you can find all the full form of these, and there are some checklists are associated with this. So we are also publishing one Indian Journal of Research in Homeopathy, IJRH. This is an internationally acclaimed official publication of CCRH, publishing quarterly in print as well as online. Since first issue in 2007, we have published 14 volumes comprising of 50 issues with research article on homeopathy. The journal was made open access online in July 2013 and is following rigorous double-blinding peer-reviewed process to provide constructive feedback to authors to improve submission quality. To ensure wider research and wider reach, the abstracts are published in Hindi, Spanish, French, German, and Chinese. So in the last, I just want to say that there is nothing like success or failure in any research. The most important thing is that you should convince with your results, whatever they are. Science is simply common sense of its best, that is rigidly accurate in observation and merciless to fallacy in logic. So for everyone, I just want to say, believe, be persistent, regular, and disciplined. Thank you. Thank you very much. This is from my side now.
Thank you. Thank you so much, Dr. Kaushik, for your elaborate information. And I'm sure we'll try to share a small list of requirements for clinical research with the group subsequently in the webinar.
Yes.
So, I would request you to inaugurate one video. Before that, I'll just give you a little brief on these videos. See,
Okay.
every practitioner, every homeopath is confronted with a lot of patients from public, from allopathic colleagues, as well as from the homeopathic colleagues about homeopathy, right? There are a lot of wrong and right ideas about homeopathy. There are a lot of challenging issues and patients. And many times our homeopathic doctors or the students are not able to answer. They don't know how to answer them. Though they might know that they have answer, but they don't know how to verbalize it. So keeping this in mind, we have produced around a series of 400 educational homeopathic videos to benefit the homeopathic practitioners, to benefit the homeopathic students, as well as general public to know about certain scientific aspects of homeopathy, certain myths and facts about homeopathy, and so on. This also includes some of the, especially 40 videos which I've made based on my clinical experience with homeopathy for 40 years to mark that particular year. And so these videos are in 6 different categories, and we'll try to inaugurate this today. Every speaker will launch one video as an example. So I request Dr. Subhash Kaushik to inaugurate a video on the power of science, homeopathy, the power of science. It's a 1-minute video. Dr. Kaushik will be sent one link. You have to just click on that link.
Yes, I have.
And and it will be shown to the audience, and subsequently this video will be shared with everybody. So the link is there. Just click that.
Okay, here.
Yes, just click the link, please. Yeah.
People often view homeopathy as fulfilling science or philosophy. My
Some
understanding
people view homeopathy as faith healing, pseudoscience, or philosophy. In my understanding, homeopathy is none of that. In my view, homeopathy is a pure science and backed by the power of science. Because two fundamental principles, that is the law of similars, which is nothing but the hormesis, and the use of potentized medicines, which is nothing but a kind of nanotechnology. Blending of these two fundamental sciences and applied with 1,500 such homeopathic medicines based on these principles. They show scientific efficacy in vitro, in vivo models in phase 1, 2, and 3 trials, and it is proven. Based on that, homeopathy is a pure science and backed by the power of science. Thank you so much, Dr. Kaushik, for inaugurating this video. And likewise, we have many more videos. And this video is part of our first series of World Homeopathy Day videos. So from today, we will launch one video for next 10 days until 10th of April. And every video will talk about some important aspects that people in general would like to know about homeopathy, or they should know about homeopathy. So thanks for that. Now we move to our next speaker, Dr. Anil Habbuji. I am reminded that when I was studying in the college in 11th and 12th standard in SIS college, near my college there used to be one clinic. I didn't know there was a clinic, but there was a clinic, and there used to be a huge crowd of people. And as a young boy, I used to always wonder, "Ye kya hai? What is this crowd?" And then after a couple of years, I realized that there is one homeopathic doctor sitting there, and that used to attract a crowd of around 100 to 200 people in those days, near to our SIS college in Sion in Mumbai. And that doctor was none other than Dr. Anil Habbu, and his co-practitioner, Dr. Kulkarni. So Dr. Habbu has been an allopathic doctor converted to homeopath, and he has rich experience. He's one of the most senior practitioners in the city of Mumbai, and I'm personally waiting to hear him and his clinical advices. We have chosen 8 clinical advices from Dr. Habbu. Mike is yours, Dr. Habbu, sir.
Good.
Thank you. Thank you, Rajesh.
Thank you.
I'm trying to tell you, first of all, let me congratulate Rajesh on his achievement of 40 years of practice.
Thank you.
Well, I have completed 50 years of my homeopathic practice and 5 years of allopathic teaching. And homeopathic teaching for almost 40 years. Anyway, with this, I'm trying to see how one can grow in the practice. I'll give you an example of finding out as to how you can find out from physical journals how many things when patient enters your cabin. I will take an example and compare few things here and there and tell you how to go about. I'm taking natrum mur for my favorite drug. That is a different thing because natrum mur women are beautiful, and that is one of the reasons because they are 10 in physicals and all that. They are most beautiful. Their eyes are absolutely Meenakshi eyes. That is called Meena eyes. That is not MEAN. Meena means
Fish.
fish. That is how they are so expressive when they actually enter your this thing. There are two types of Natram Moor personalities that can enter your this thing. First of all, when they enter, you see the most proportionate woman coming in your cabin. All right, face, they call it oily. In finding, you will not find it oily, but it is a stretched skin which is shiny. It is not oily. Oily skin always attracts pimples. So, example is petroleum. Petroleum has seborrheic dermatitis. So, you can leave that particular thing very precisely. Other things that can come near is they are not obese as graphitis, antimony crude, natrum, nitric acid, or CC for that matter, and they are similar to sepia. But apart from that frown that they have, the sapiens have the frown, and sapiens are flat chested. And you can always see perspiration in the armpits when a sapien enters your cabin. Plus, a woman who is Natramur will enter your room. If she has come from outside, she will always wipe her nose because she has perspiration on nose and upper lip. This is my first observation of their coming. Natramur is not thin as phosphorus, silicia. So question doesn't arise. For Natramur doesn't appear old for his or her age. She appears young for her age. Even if she is 50, she appears 40. If she is 60, she appears 10 years younger. How to, that is your first calculation, and you have ruled out graphitis, etc., etc., etc. All right. The moment she wipes her nose and upper lip, you come to know that you are likely to diagnose her as, unless she is wiping the whole face. That is a different thing. She is wiping only the nose, and she is a person who is definitely tenacious of the purpose. If the same person, mind you, is stressed, he develops what is called as border of the hair, border of the hair psoriasis. Unless she is stressed, you will not be able to find out that stress and the psoriatic border of the hair. Apart from that, if she is stressed and you ask her a question how, what caused it. Then she will start weeping. The only few of the droplets come from the eyes, and immediately she will say, sorry, sorry, sir. She wipes and she smiles. Smile despite the tears in the eyes. This is the hallmark and PQRS of Netram Moore. Read Margaret Tyler. Unless you are good with your materia medica, you cannot grow. Now, once you have come to know that the cause may be silent grief, I have cured a person of a typical migrainous headache when she was denied to get married to a person she liked from another caste, another language, person from another, knowing another language. Being Maharashtra, he was a Maharashtrian, and she was a Tamilian. The moment I asked her this question, are you disappointed in love and affection? She started weeping, but then immediately she recovered herself. I told them, get her married to this man. She is in love with that man. And they agreed, and she is happy with 2 children because she met me at the airport after 30 years of this incident. And she recognized me. I couldn't recognize her. But then that was the case. So this is one of the, whereas expressions are like this, antimony crude is expressionless. Nitric acid is angry personality. Person has a bulldog face, oily. Sepia has got frowning. Lachesis never looks in your eyes. Mind you, they will always, when you ask questions, they will look like this, like this, like this. They will never see you in your eyes. Face. I have already told you the Netram Moore face is stretched. Now, Bovista has oily skin, acne, loose motions on the first day of the periods. No, no loose motions during the periods, not just first day. First day is only ammonium carb. Then petroleum has pimples on the, I told you seborrheic dermatitis earlier. Then Thuja has an oily face, but the face is wrinkled. Mind you, selenium also has oily face. Now with this, we have come to some conclusion that the person could be Natram Moore. So once we know that the person is Natram Moore, you can always ask few questions and try to impress. The questions would be like, are your teeth sensitive? Do you have bleeding while you're brushing? When you have you go in the sun, you get headaches which are left-sided coming from behind to forward. All those things you can ask, and if the answers are yes, the patient knows that you have touched the fathom of her complaints and understood her malady or medicine, in our words, constitutional medicine. With this, you can always say few things which touch the person, like uh, like when you have gone to the place is dirty, she will not pass her urine at all. So she will pass the urine before starting. She will avoid passing in public places. So these things, if you tell her, she knows that this doctor is marvelous and your practice will start growing. With these words, I end my speech. You must know your materia medica very well to have PQRS of each medicine within you. I have told you other drugs which have some PQRS like this. I think the time given to me is over, so I'll thank you very much
Thank you. Thank you,
to me.
Dr. Habu. Thank you so much. I'm sure those people who are in the practice of homeopathy, they will be able to appreciate the gems shared by Dr. Habu. Small observations, but over years, that's why they are valuable. Tips and hints on Bovista, petroleum, netramure, sepia, and all, legacies, etc. in a short time of 10 minutes is a simple reason for me to think of a long session dedicated with Dr. Habu on another day. So we are also planning that we should have some individual sessions with some of the leading speakers and teachers, over time. Maybe if there is enough interest, I would like to have 1 hour session with Dr. Abu and other speakers periodically and try to get the best from what they have experienced. So thank you so much once again. I would request Dr. Habu to inaugurate one video from a series on homeopathy journal videos, and my team will share one link with you, Dr. Habu. You have to simply click on that link, and this video,
Okay.
Is a 15 minutes long video, but we are going to show only maybe 1 minute or two. We have spent a lot of time on creating this video. I would say a few months. This video is titled "What is Homeopathy?" And I'm sure in the coming days, people would like to watch this video, and this video will answer a lot of concerns and questions that homeopathic students might have, homeopathic doctors might have, common people, the skeptics, the researchers, policy makers, all of them will find some information from this video, I'm sure, because this is also a crux of my learnings about homeopathy over time. So a link, kindly, please click on that link to inaugurate this video, Dr. Habu.
Where is the link?
It's on the WhatsApp on your mobile.
WhatsApp. I have to get the mobile, please.
Yeah.
I'll get it in one.
So in this video, we'll talk about the latest understanding about homeopathy, how I perceived, in the new light of the science. And I'm just trying to fill in this gap till the time Dr. Abu clicks on the video. So done, right? Yeah.
I haven't got that link, please.
Yes. So did you
I
find
opened.
Yeah.
Yeah, I got it.
Yeah, just click on that.
I clicked.
Yeah, thank you. Hi, I believe most people in the world must have heard of homeopathy. Many of you must be having some first-hand experience or experience with homeopathy in the family, having some benefits with homeopathy. However, homeopathy still requires to be introduced, and it is worthwhile that we talk about what homeopathy is. Yeah, this is just a glimpse, and as I said, it's a long video, 15 minutes. A link to this video will be shared with the group, and it will be made available instantly now on YouTube. So please do watch this and give your feedback, make your comments and suggestions as well. Thank you, Dr. Abu, once again. Now we will head to the next speaker. Is he there? Yeah, we will have Dr. Jaswant Patil with us now. Most of you know Dr. Patil. Dr. Patil is a qualified pulmonologist, a cardiopulmonologist from the conventional system of medicine, and he turned to be a homeopath. And I have requested Dr. Patil to share his thoughts, especially about 8 learnings from his practice, which could benefit the practitioners and the students. So over to Dr. Jaswant Patil.
Hello, everyone. It's a very good afternoon First, I'd like to congratulate Dr. Shah completing 40 years and doing the best research that he has shown me, written many books, and it is really a good contribution to homeopathy. Second, my guru, Dr. Habbu, Anil Habbu. When I was an allopath, I met him and he showed me a short ways how to find the remedies. I was very much impressed by him, and on the basis of that, I started doing, instead of taking long histories, in a short span of time, he used to say, "This is the remedy, this is the remedy," and it works. And many times when I get into a problem, I always call him. He, "Sir, what is the remedy?" In 2 minutes, the remedy works. So I would like to share my. Can I share?
You have a PPT?
Yes, a very short PPT.
Okay.
I think that is. I think it is not. Can you see the PPT?
Yes. It is visible.
So it is visible. So in short, I would say my appropriate case as per the classical homeopathy in the start, if it is a simple and this, if it is a complicated, then it is always in the zigzag way. And when it is an ICU and a very critical case where it is incurable, then I use the zigzag method of combining all the remedies. And best part is that when you are a broad-minded physician, then only you can cure the sick in a rapid, gentle, and permanent way. Usually, incurables have been said they cannot be cured by homeopathy, but I've got multiple examples that I have learned. In ICU, when I started as its first, one prescription of allopathy and one homeopathic, giving to the myocardial infarction complete heart block. A dose of arnica 30, cactus G60 repeated 2 or 3 times, and finally within hours that everything came down and it was isoelectric. It was surprise for me because it was my first as a started using homeopathy. Of course, I came to this homeopathy because of my mother. A single dose of arsenic iode 200, just flip open and clinical picture fitting in, not all the individualization and nothing. And it worked wonders and saved my mother for 12 years after that. And after that, I was doing all classical homeopathy, single homeopathy, and I encountered a case where I couldn't treat, I failed. And he went to some Bhiwandi doctor with 10 mother tinctures and 6, 7 remedies. He came back with all ascites cleared, everything cleared. I was surprised. I said, what is right homeopathy and wrong homeopathy? 200 years back, what we are there. And in today's world, when the scenario has changed, vitals have changed, and we should learn from all those things. So in ICUs, it is always never to lose hopes. Try everything that is going to save the patient, even if you have to go beyond boundaries and fixed conventions. In short, I would say learn to be wise, dare to be wise. I'll show you a COVID case, 40 years, with just at-home treatment and one oxygen cylinder. From 40, it went to 96 in 7 days' time, and he was saved. Of course, for Kalicar for heart failure, Veratrum viridi for arteritis and hypotension, Carbovage 30 to improve oxygen, Abrotenum 200 for severe inflammation of the lungs, and Cactus G60 to improve the coronary circulation. You see, this man has started walking, and with a 40 oxygen, even with this and heart failure, known case of IHD, and he has improved so much. And intercurrent remedies were given every hour, antimtat 200, 3 early, so arsenical, because when this time is short, I cannot explain you everything. Bryonia for interstitium of the lungs, aconite for fever, antimtat to clear the pneumonia, Carbovage to improve the oxygen. After Bryonia, Carbovage works better. So always I have failed when I gave only Carbovage, Bryonia and then Carbovage. Ferrum Phos 32 early to improve the arterial inflammation, microcirculation inflammation, and Lachesis 30 was his constitutional dose. Then in case 2, the MDR tuberculosis is not responding at all. And all third line drugs also failed. You can see all these things and these 2 X-rays and you see the final clearing. So what were the drugs used? aconite fever, staphysia, bad feeling, arsenical anxiety about his children, calcarea phos always works on the cavities in the lung, carbovage for despair, anger, driving to suicide. He wanted to commit a suicide. Ferrum phos 60, involvement of capillaries and anemia, ignatia for grief. When all these things are combined, you get faster, rapid, and gentle relief. And he's totally free. All the side effects of were taken care. Fifth learning, prevention is always better than cure. I've tried arsenic help in the battalion of hundreds, two batches. One batch got arsenic, second didn't get. And 26 who didn't get arsenic, they were having 26 cases from the same spot, hotspot. And another who got the arsenic, only one got that, and that too he didn't take arsenic properly. So it was a miracle, and the power of homeopathy was then that we also got viral, and arsenical was more used. Then in incurable and no hopes cases, you see this is the ICU patient with a brain trauma and the brain coming out. And finally, he was sent home by putting in the plastic parietal bone, packing the brain and say it's all neuromalacia and the patient is not going to survive. And finally, he was sent, he came to me with this. And finally, we started with the medicine. This is all the head repertorization. I always do repertorization. And so many medicines were given to him. And if it's not time to give the explanation for all, but I've given an example how I select. And when he was with this, in 7 days' time, we've got this. And then in 1 month's time, he was doing puja with the rice tube and the urine bag in the hand. And he was walking, and then he was writing with no neurological deficits. And finally, if you see him, and then this is the final victory, which cannot be seen in such a bad case with total brain damage. It is really a miracle. And if you see, because I used all these medicines, I could get this relief. And you cannot recognize him from where he has come to what. Disturbed mind is always over that. And in the case of psoriasis, which was not getting well, it was getting control relapse, and finally, with staphysia gria, because he was having the guilt. His father went to a old age home, and he was fine. And this is a case of mucormycosis from cribriform fossa going to the brain, and she was given 70 amphotericin, sent home from the hospital, and said finally let her die. And if you see her, from there, she was totally delirious. And she couldn't stand also. And then she started walking, and then she started doing the job, and then she was doing all the well. Finally, she got so much better that she started taking accounts from the daughter-in-law. And then at the end, she was having a cup of tea with all the family members. These results in homeopathy are so much inspiring that only thing is that you have to dare to be wise and dare to use the remedies where it is required for a constitutional, followed by what is indicated. What Sir finds by the science, I finds by the pathology. And many times it has worked wonders in my life. The time is short, so I cannot show you more cases. But in short, what is the final thing to learn? Final thing to learn is only that you have to think of a patient. Think what is the mission of the physician is to cure the sick. That should be the final mission. And dare to be wise. Where there are, I was always feeling sad, or I was feeling guilty. Am I doing wrong homeopathy? But when the COVID case of first died, after that I looked to the Italian post-mortem where this virus was bursting the capillaries and doing the interstitial fibrosis. I asked one of my colleague who was working in ICU. They said lungs become stiff. What it takes 20 years of time. In 6 days, the lungs become so stiff that even ventilator does not pump in the air inside. And that then say bryonia is always on the interstitial tissues. That has worked well. And ferrum phos and veratrum viridi, where when I combined this remedy, the results were marvelous. When there is a pneumonia, the antitard and chelidonium, uh, these worked very well. So pathology wise and fear should be taken care of, because whatever remedies we give, the fear is not taken care of. Many times we do not succeed. So this is in short that I have explained to you and shared with you. Thank you.
Thank you very much, Dr. Patil, for be dot on time. And in 10 minutes, I think you shared a lot of things. You really talked about daring to be wise. A few things which are very clear is that for a successful homeopathic practice, one must have sound medical knowledge. And that has been my experience as well. Without medical knowledge, you are likely to make blunders. And one of the reasons why India has more successful homeopathy than elsewhere in the world is because Indian homeopathic doctors are medically trained versus a lot of other countries in Europe and all, where non-medical individuals are allowed to practice homeopathy, and that's where homeopathy has gotten compromised in my view. Why is it getting? Dr. Patil has also made a good remark about the need for using multiple remedies in some cases, and he has shown that courage to talk about it. Many people, they practice multiple remedies, but they don't have courage to say. In fact, there is no crime in using multiple remedies when they are indicated and required in the given case. So there is no need to be rigid about using single remedy when we don't know what is the single remedy. And in fact, I made a series of videos which are part of these 400 videos, where I spoken very boldly about the need to change and not to be rigid about what we have been doing very blindly. And last point is that to practice homeopathy in the critical care, as Dr. Patil has spoken about, you need to have not only medical knowledge, you need to have good experience and conviction about homeopathy. If I have to select one of the few people who have thorough conviction about homeopathy, probably more than what conviction I have about homeopathy, that is my friend Dr. Jason Patil. I am saying without any exaggeration, that kind of conviction this man has. I request Dr. Patil to inaugurate one video from a series of journal videos and disease videos. We have a series of around, I guess 60 to 80 videos where I talk about the role of homeopathy for various diseases. So since he being a pulmonologist, I request him to inaugurate this video on homeopathy and asthma. You must have received one link from my team, Dr. Patil. You have to simply click on that, and that will be launched.
There is no link I have received on the homeopathy webinar app.
No, you are getting it. You are on WhatsApp. You'll get this link.
Sure, you'll get the link. I will get the
link. This is from a series General Diseases where, yeah. Thank you for clicking on that. Asthma or bronchial asthma is a very common disease affecting people all across the world. And it is very important that every patient of asthma should know about homeopathy as an option. In today's world of information technology, it will be considered ignorance if you do not know that homeopathy also has a big role to play to help control your disease, which is otherwise a lifelong disease. Asthma affects almost 10% of the world population. In this video, we'll talk about asthma affecting the adults. Asthma is essentially an immunological disease. Thank you. So this was just a glimpse and initial part of the video. Link to the full video will be shared in the group, and it is made available to everybody and anybody on YouTube. Thank you, Dr. Patil, for launching this video. Now it's time that I switch to the next speaker. Our next speaker is a young man, a young convinced, committed homeopath who has been working on cancers for so many years. He is coming from the extreme south of India, from Kerala. We have Dr. Vinu Krishnan, and he will talk about around 8 clinical tips and advices on cancer management using homeopathy. Dr. Vinu.
Yeah, good evening, sir. Good evening, Dr. Rajesh and other luminaries, and Dr. Patil. We are once again together.
Yeah, yeah.
Okay, see, enlisting or enumerating oncology in 8 points, it is an extremely Herculean task, but I will try my level best to motivate our juniors. So my plan is 8 points. Point number one. So to approach oncology, we need a plan, and my plan is integrative oncology, of which 80% of the cases we need an add-on or adjuvant mode, and by 20% of the cases we can go for a monotherapy or rather a standalone therapy. So coming to the 80% of cases, our plan is either add-on means adjunctive or adjuvant. That means after a definitive treatment, homeopathy can make significant change. For a sample, we can say in pain control, in our hospital, we adopt an ABC approach. Capital ABC means epismal 3C or 3X or aconite 1M. B stands for belladonna 30 and bellis perennis, and C for chamomile and calcare carb, 3C or 30 potency. Give as much as low. That is our policy in pain and repeated frequently. For cancer fatigue, we use acetic acid 30 and zoranum 1M. Again, add-on plan, we can have cases on hormone negative breast cancer, which is a very challenging cancer in conventional medicine. That is triple negative breast cancer. We use homeopathy as an add-on therapy for extended survival. In myeloma and lymphoma, homeopathy can be used as an add-on therapy. In gastrointestinal malignancy also. Another area is when tumor marker makes an upsurge, even if a patient has undergone multiple line of chemotherapy or surgery or radiation. For instance, CA125 or CA19.9 in pancreatic cancer is getting increased. There, homeopathy can make a significant change by an add-on mode or an adjuvant mode. Coming to the monotherapy or a standalone plan, we use this as frequently in stage 4 lung cancers, and that too with no identified mutations. For example, EGFR, ALK, ROS, no mutation. If a mutation is there, conventional medicine gives monoclonal antibody or tyrosine kinase inhibitor. So in stage 4 lung cancer, also in hepatocellular cancer, where multifocal hepatocellular cancer, where no other therapy is indicated, for example, radiofrequency ablation or transarterial chemoembolization is not indicated monotherapy. Also in relapsed hematological malignancy, we can give. Coming to the second point, we need an angle of treatment. First was the plan. Second is the homeopathic angle. We usually say that there are multiple approaches, constitutional, specific, pathological, but the student or the beginner is extremely mired with how I choose. So here I give a simple tip. Constitutional approach is used whenever there is no active pathology. For example, a case is coming with a CA breast and the patient has undergone surgery, either radical mastectomy or a lumpectomy, we can give a constitutional remedy. There are no pathologies there, active pathologies there. Or rather, he has come after a chemotherapy, after a scheduled chemo radiation, we start with a constitutional. Then second is specific approach. Here, an active and aggressive pathology is welcoming us. So we should start with a specific medicine. It's just like the organopathy approach. Then pathological approach. Here, when constitutional symptoms are so lacking and pathological symptoms are increasing, we use a pathological simile as put forward by Compton Burnett. And a physiological approach, usually we use tingers. No? When specific organs are get obstructed, their physiological drainage is a problem. We use a physiological approach. The third point is first step method. We term it as a hooking concept because in oncology, patients may be coming with multiple symptoms, multiple therapies, tyrosine kinase inhibitor, monoclonal antibody, radiation with cumbersome economical problems. So our aim, naturally, I feel that many of the beginners, rather junior prescribers, they used to take the case in the whole and start with some deeper medicines, and which will lead to extreme chaotic, as just like our master Kent has warned in his first and second observations. So here we derived a methodology called as a hooking concept. For example, if a patient is coming during chemotherapy or after chemotherapy, we will start with CKL core 30 or cadmium sulf 30. or acetic acid 30, just to hook him from the well or just to make him to the optimal physiological level. There we used calendula 30, staphysagria 30, abrotanum 6C, just like medicines. After that, the case will be more clear and we can go with a more and more deeper medicine, starting from animal kingdom, moving to mineral element or metal. That is the hooking method. Coming to our fourth point, what is pathological simillimum? Actually, Richard Hughes has propagated it. Compton J. Burnett has done it. Clark's Medicare says that pathological simillimum has a significant role in deeper pathological states. We use low dilutions, 1x, 3x, 3C, 6C. For example, in glandular malignancies, we use conium. In liver malignancy with the bradycardia, we say it is digitalis. Or with a liver complaint with hemorrhage, then phosphorus. Rectal cancer with liver, then cardus. So there are pathological combinations which help a prescriber to get into the case first, and then after that the case is in a streamlined mode, we can go with more deeper medicines. So pathological simillimum has its own value in deeper cases, not in itself in cancer, but in immune suppressed conditions, in genetic conditions, in degenerative conditions, wherever the immune system is more suppressed or more in a desperate attempt saying that I am ill. So don't go with high medicines. Start with pathological symptoms, what we are getting. Because, for instance, if a patient is having pancreatic cancer with liver metastasis, naturally his bilirubin will be high, his ammonia level will be high, his IHBRD, intrahepatic biliary radicular dilatation, will be there. Totally, the patient may not be in a state where he can't take even a cup of water. Then what symptom we take? Just take the pathological symptom. And cadmium sulf, iris versicolor 3C, diascoria 30 make significant results. A cadmium metallicum also we use in our center. Coming to the fifth point, in regarding metastatic cancer, which is a cocktail of cancer. Metastatic cancer means, take for example, a patient is having a cancer breast. She might have received the scheduled chemotherapy, radiation, and if it is HER2 negative, HER2 positive, then she might have received trastuzumab injection, which cost 1 lakh per one vial, and 17 injections have completed. But still, with further meds into liver or bone or desperately into brain, what she will do? So they will term it as widespread metastasis, limited options of treatment. What can we do? Poor prognosis, explain to the bystanders. This is the common usual scenario we are getting in the discharge summary. Advanced nature of the disease, limited options of treatment, explained to patient and bystanders, and they will come desperately to homeopathy. And metastatic cancer, we have made a cocktail of prescription, and it is just like this. We select a constitutional medicine, and definitely we use an LM potency only, and that too repeated daily. If calcareous carb we feel it as, then we will start with 0/1 or 0/3, going repeatedly daily or alternate days. Along with that, we add specific medicines, for example, Helleborus, Ruta, depending on the sphere of action. Then physiological prescriptions, if needed, to make the channelized secretions like ceonathus, chelidonium, condurango, podophyllum, sebalsorlata. Also, sarcodes have a big role here, as thyroidinum, lecithin, euphorinum, pepsin, we use frequently as pancreatinum, as supplementary medicines. We can see that in conventional medicine, they use R-CHOP regimen. R-CHOP regimen means it's a combination of cocktail of chemotherapy, which is highly toxic and it devastates the economy, because they also know that the situation is very grim there. The pathology is more advanced, then they need multiple remedies. So why don't we hesitate with single remedy, just like Dr. Shah and Patil sir was saying that depending upon the war scenario, we have to change our armamentarium, we have to change our plan, and don't be rigid with saying that single medicine will come only when the case has grown into a more mature level in a homeopathic way, and in a more coherent way, we may be able to decipher a single medicine, and that will make the patient more better. But before that, in a constitutional medicine setup, we need a cocktail prescription. Coming to our sixth point, in relapsed cancer or recurrent cancer, which are nowadays a biggest challenge in the cancer industry, because relapsed cancers, just now I told the patient might have spent lakhs of rupees according to the scheduled chemo radiation, or the whole drama will be over. And here comes the usage of nosodes. And here we use nosodes first in a high potency, in a centesimal potency, either 1 or 10 only one dose, followed by again a medicine in LM potency, then medicine specifically from mineral, metal, or that group only. Because I always warn my students or in my lectures that in oncology or in pathological states, vegetable kingdom medicines cannot be of much use. Some use we may get from an animal, but the more usage is coming from mineral or metal group. So with wiseful and judicious plan, with tapering of the life supporting medicine, many a times I see that homeopaths say in with more confidence that stop all the supporting medicines, just like dexamethasone or anti-epileptic. No, in relapsed and metastatic cancers, just obey with them. Dexamethasone is a life-saving drug, is a corticosteroid relieving edema. Just go with it. Wiseful and judicious tapering of life-saving medications with our cocktail prescriptions make patients better. Coming to our seventh point, no sorts, its usage and relevance. Many times for this, you can use Diontal, but there's a book, Brunnett Redefined. It's a book available in Amazon. Going through Burnett, I think nowadays college students may not be seeing this book, but Burnett's books are of immense value. Summarize, I can say that basilinum. Basilinum is for glandular malignancy. And basilinum is having the similar action just like tuberculum and thyroidinum. Left apex lobe will be affected in the CL lung cases. Medorinum going for solid malignancy. Syphilinum for liquid malignancy. Liquid malignancy means hematological malignancy. Either it may be a lymphoma, leukemia, or myeloma. You can use syphilinum. Then serenum. Serenum for cystic tumors with suppuration. Then melandrinum for relapsed cancer. And tuberculum for relapsed with wide metastasis and a history of debilitating illness. So that is the classification. Glandular malignancy, we can use basilinum. Basilinum is useful for specific alopecia after chemotherapy. You can try basilinum. Lungs, then medorinum, solid malignancy, liquid malignancy, serenum, tuberculum, and melandrinum for cancer labs. Coming to our last point, that is oncological emergencies, how we will deal with oncological emergencies. And when we hear about emergency, we might think it is a paraplegia. No, fever. Fever in malignancy is an emergency because fever, as you all know, it's very difficult to manage in an oncological setup because that fever arising from a malignant background is, we can term it as a malignant fever. There, gentian chirata, that medicine, veratrum virid, China, some specific medicine gives good results. Aconite in tincture form, that will, these are highly applicable in an IP setup. As you all know, I represent an inpatient cancer center where we frequently use this type of medicine because these type of fever come with a rigor, just like it simulates Plasmodium falciparum affections. Because in malignant fever, it look like either we may think it is a cystitis or UTI. The fever will be of high gradation. It will continue. And also with that, bleeding is an emergency. There we use Crotalus. Crotalus 30th potency have given immense result, and Hamamelis 30. Also, if the bleeding is continuous and the bleeding is of a malignant nature, Lacassas is a good remedy, irrespective of the site we use. Another complications we usually get is organ failure. Organ failure because patient may be a stage 4 lung cancer. He might get contracted with bronchopneumonia. Then when we shift the patient to a ICU, we are having an ICU in our center. There the most potential challenge is the patient may either go to a respiratory failure. Their acid hydrocyanic 30. It is a boon, hydrocyanic acid 30. It can bring back the patient just like carboveg 30 do. If it is a cardiac failure, we are expecting adrenaline 30 is our choice and Profandus 30. Usually convallaria majors, that's a good medicine which help to improve the beating of the heart. We usually say it is digitalis, but I think and I believe convallaria is more active, just like Strophanthus. Strophanthus is also having immense action, and Strophanthus we need not use in tincture. 30 can make magical effect. Adrenaline 30 and stuff like this. And if it is a renal failure, we are expecting Singiber and Solidago are our choices along with acetic acid 30. If it is a hepatic failure, renal failure, a liver failure, we are expecting, then Naxomica 30 and arsenic 30 are the first medicines, followed by Myrica. Myrica is a medicine which can make great changes in the LFT values. Nowadays, the child pulse scoring or BCLC staging has been changed for liver, and it is now the ALB bilirubin score, score made by albumin level and bilirubin level, ALB score, that judges the prognosis of liver cancer. And if we expect a neurological failure or a neurological damage, the potential medicine we are getting help is Helleborus. Repeatedly, Helleborus 3C, 6C, or 30. Then Hedera helix. Hedera helix is a medicine which can immensely reduce intracranial tension. Hedera helix in 6C potency we can give to the patient, or Singamet. Singamet can also make a drastic change in controlling intracranial tension. So summing up our 8 points, the usages of pathological simile, we should have a plan of action, either integrative, and we should have an angle of homeopathy, and we should have an idea about metastatic cancer, relapsed cancer. And a word of warning to all my listeners is that never take a hematological malignancy case first, because that will spoil your whole brethren. Wait for a hematological expert or a medical oncologist to assess and to have an oncological workup. Because in my experience, I feel relapsed case of hematological malignancies are better controlled by homeopathy more than a primary stage, because leukemia is an exploding disease which will go to multi-faceted
Dr. Vinu,
thing.
yeah,
Thank you. My time is over. And
thank you.
Thank you.
Thank you so much for talking so passionately and so intensely. Though you take a little extra time, but it has been very intense and a lot of information. Thank you so much once again for that. Quickly, I would request you to inaugurate and launch this video on cancer prognosis series. You will receive one quick link. You have to simply click on that. We have a series of videos on prognosis based on significant experience in the treatment of various diseases using homeopathy. We have spoken about prognosis of ulcerative colitis, underactive thyroid, ankylosing spondylitis, urticaria, lichen planus, vitiligo, and so on and so forth. One of them is cancer. So, please click on the link which you have received. We'll show a small glimpse of this video.
It's an YouTube, no? YouTube
Yes,
link?
yes. Just simply click on that.
Yeah. Is it okay, sir?
Yes. Namaskar. Today we will talk about the prognosis, that is the scope of treatment using homeopathy for the cases of cancers. I must say that cancer is a complex, difficult to treat disease, as we all know, and it is such a disease which cannot be treated by any single mode of treatment. It cannot be always treated only by surgery or only by chemotherapy or only by radiation. It requires a combination of more than one modality in most cases. At the same time, one may also require homeopathy to be added as a part of the treatment protocol for practically all kinds of cancers. Thank you so much. Thank you. Rest of the video you all can watch through the link which will be shared your thoughts. Now we have Dr. Wayne Jonas with us from America. Good morning, Dr. Wayne. Thank you for joining us. He has taken a time to talk to the Indian homeopaths after many years. And Dr. Wayne is a former associate director of NIH, that is National Institute of Health, a body similar to that of ICMR in India. And he is an allopath and a homeopathy researcher. And he's going to talk about not only homeopathy, but he's also going to talk about general aspects of healthcare, and homeopathy and other systems of medicine all put together. Over to Dr. Wayne Jonas.
Well, thank you very much, Dr. Shah. Can you hear me?
Yes, very well.
Can you hear me? Great. Okay. Wanted to make sure that was going on. And first of all, congratulations on your long experience, decades in contributing to the homeopathic work. I have a little bit more time than you on that, since I started studying this even before medical school, actually, before I even went to medical school. And then I continued to study with Professor Jost Kunzli from Switzerland, who got his training in direct line from Kent. And then I traveled the world looking at different types of homeopathy, from the German homeopathic prophylaxis to the French clinical approach to the British components, and then also traveled to India to study with some of the masters there, as well as Africa, George Vilfaucus and others. So I saw a wide variety of approaches in those areas. And when I was in the military, I began to study this in the laboratory. When I was at NIH, began to actually wrote a book about it when I was at NIH in these areas. And I'm going to give you the experience of the 8 lessons that Dr. Shah asked me to talk about, from not just practice, but also my experience in science and policy, because I've done a lot of work in science, and I'm also going to give it to you my perspective from the US, which is very different than in India. Okay. In the US, homeopathy is still largely considered quackery. And it is not widespread, and we do not have the experience that you have in dealing with serious cases anymore. 150 years ago was the golden age here, where it was very prominent, but that is no longer the case. And it's struggling here in the United States to even help people understand it. So this is April 1st in the United States. It's called April Fool's Day. And that means don't take anything that I say as the truth, because it might be an April Fool's joke. No, not really. So here are my 8 points, all right? In studying all of these different types of approaches in homeopathy, I found the most profound changes that occurred in the transformation of health of any individual was when you really stuck to some of the classical approaches in these areas. This means the strange, rare, and peculiar, the general matching of the symptoms, the mental matching of the symptoms. And when that scenario came together and you hit the remedy on the head in high potency and waited, you would see the activation of the inherent healing response, which is what it is, which is what it attempts to do, and saw really remarkable cases in those areas. At the same time, if you go to the research and you look at the meta-analysis of placebo-controlled trials, the largest effect size and the most robust data is not from the classical studies. It's from the combination studies. It's from the clinical studies. It's from the pathology components in those areas. And we've published on this. I published it in the Lancet many, many years ago, and it's been confirmed a number of times. So there's a little bit of a disconnect from my clinical experience and what you see, at least in the top of the best type of placebo-controlled research. My third point is that I've noticed that things have changed over the decades in terms of response. First of all, children respond much better than older people do. You would expect that. Some really dramatic cases occurred and have occurred and are gotten with children. But at the same time, as conventional medicine has begun to come in and everybody gets it now, and we just saw cases of cancer and serious illness that are getting lots of different kinds of treatments, I find that makes it extremely challenging to figure out how to use the classical approach and get that robust response in those areas. Elderly people that are sick in those areas that are getting multiple treatments just don't seem to have the same robustness in response, or maybe we're just not good at finding the right remedies in those areas, and it's very challenging. We just saw an example of that. I think patients have also changed over the decades. At least in the United States, patients no longer have patience, meaning they're no longer willing to wait for the healing response to manifest itself. Some of the tremendous and deepest healing occurred when a single dose of a remedy was given right on the mark, and then they waited, in some cases, months. And they would come back and they'd say, gee, this particular thing hasn't occurred, or the pattern of symptoms have changed. And patients today are not willing to say, let's just let your healing response continue to unfold in these areas. They want more immediate response, and this is getting worse. So this is making it more challenging to use an approach like homeopathy that relies on that inherent healing response and the time required for it to occur. My fifth point is that I think the debates in homeopathy in the modern scientific age are largely useless. And that is because they're based on opinion. Experts who, with their great experience, still have a lot of judgment flaws because they do not have data and they do not follow all of their patients sufficiently to consider it good science. And so they end up being opinion or imagination or no evidence. And so we get a proliferation, a growth of all these different theories and philosophies and approaches, et cetera, et cetera. And we end up debating ourselves, and the scientific community on the outside looks at that and says, what a bunch of crazies, okay, in those areas. They have no idea what they're talking about. So the sixth point is homeopaths are their own worst enemy, because they actually are not doing what they need to do to get into the modern scientific age, to do good, high quality, robust research, admit their failures in those areas, and use good evidence in those areas. See, again, I'll speak for the US. In the US, where the homeopathic pharmacies are perfectly happy to follow the current laws, which have a niche for homeopathy that allow them to sell their remedies without doing science. And therefore, they don't want to disturb that because that's their business model. And so they won't invest actually in doing the science. They won't actually do it. They'll say they want it, but they actually won't do it. And so we need to look inside at the homeopathic community and get our house in order when it comes to science. My seventh point is that without nano, there will always be no. Okay? What does that mean? That means the scientific community will say, no, that cannot work. It's impossible to work, therefore it doesn't work. And until we have a physical explanation that can actually go and explain what's happening in homeopathy, and nanopharmacology might be that, okay, might be that physical explanation, it's constantly going to come up against this wall of there's nothing there, therefore it doesn't work. And the mainstream scientific community will continue to discount the entire field, including all the tremendous successes and the research, clinical research that has done. Believe me, at NIH, this was the question that they had, not the clinical stuff. They wanted to know, how does it work in that area? So my final point is that, unfortunately, it's not going to be easy to do that, because the evidence, when you look at the basic research in homeopathy, indicates that nanoparticles are insufficient to explain what we're seeing. When you see signals in robust experiments going through glass, for example, there is a resonance effect going on. That cannot be explained completely with nanoparticle transform in a chemical component. When you see massive responses, like Dr. Cartwright from Oxford and the people in agricultural see by adding remedies to the water in those areas, this does not actually fit with a content component, a chemical component in those areas. And so what else is going on? When you look at some of the semiotic work, which is the idea of resonance, mental resonance and healing, biofield resonance healing, homeopathy somehow interacts with that on a basic science level. And we need to have multidisciplinary exploration into those areas to really understand what works, because that will get us beyond the debates of, oh, this remedy and that remedy because somebody said so in those areas. It will allow us to actually move into the modern age. So I'll end with that. I'll point out that Somehow I was destined to do something in homeopathy. I'm still trying to figure out what it should be because I was born April 10th, 1955. And you know all what that means in homeopathic history. So thank you, Dr. Shah, for inviting me these areas. It's a great pleasure to be here, and keep up the wonderful work that you're doing in India. It's one of the only places where homeopathy is really at the cutting edge of what's going on in terms of its clinical utility. Thank you.
Thank you so much, Dr. Wayne, for sharing your thoughts, your 360-degree overview of homeopathy in the East and West, and your research. I know there's a lot to learn from you because, as you know, last 3 years we have spent so much of time together, almost every week, and we'll talk about that again to the crowd some other day. Thank you so much once again. There is a small video launch that you have to do. You'll be shared one link. Dr. Wayne, if you could simply click on that link. And this is a video on homeopathy and allopathy integration in practice.
Okay.
This is, as you all, yes, this is, as you know, this is one of the 400 videos that we are going to release starting today by end of December. And we already shot these videos, and they are educational videos on homeopathy to benefit the general public as well as the homeopaths and the students. Yes.
So,
yeah. In general, the medical science has advanced a lot in last 200 years. We are living in a time that we have much better diagnostics, and there are some improved treatments and therapies as compared to what we had around 150 years back. But at the same time, we must also realize as medicos that even today, there are so many diseases which remain untreatable. There are so many diseases which cannot be cured truly. They can be only symptomatically relieved. They could be taken into remission, and that can be only palliated. To give you some examples, we still do not have treatment which can cure diabetes, high blood pressure, coronary heart disease, diseases of livers, kidneys, bronchial asthma, skin diseases such as psoriasis, eczema, and so many other autoimmune diseases, developmental disorders and all. So having said that, it is very important for all the doctors to realize that today's medical system has its own limitations. So many diseases that require to be treated in a better way than what we are currently doing. At this stage, we have two major systems of medicine. One is the conventional medicine or allopathy. Second is homeopathy. And of course, there are other alternative systems such as Ayurveda and more. No single system of medicine is able to cure the diseases which I mentioned. And that should make us humble. At least it should not make us rigid in believing that my system of medicine can cure everything. This is applicable to homeopathic fraternity as well as the conventional doctors or allopathic fraternity. No allopathic doctor or homeopathic doctor should become adamant or rigid in believing that only his or her system of medicine is capable of curing everything, because that is not the truth. Today, the diseases have become much more complex than before. Thank you, Dr. Wayne, for launching this video. A link will be shared for the complete video with the group subsequently. And I think now it's my turn. We are running slightly behind time. I would like to give some of my thoughts on this very special day. I'll try to share around 10 points and insights from my learnings in last 40 years of homeopathic practice. So one of the things I would like to always say is that learn to ask a question. In homeopathic space, unfortunately, we did not learn to ask questions. We took a lot of things for granted. And, somewhere in 1995, 10 years after my practice, I asked 3 questions to myself. One, does homeopathy really work? And what does it contain? And how does it work? These are the 3 questions which changed my life from being a practitioner to a researcher. So we all need to not take anything for granted in homeopathy, not even the concept of similars, vital force, individualization, etc. We should learn to ask questions, and then only we'll get some answers. This is point number 1 that I would like to share. The second very important point in my view is that, as you can read on the screen, what our actual problems are. Many times we don't realize what our problems are. We believe that finding the right remedy is a problem. We believe that finding the right potency is a problem. Understanding the mind of the patient is a problem. But in my understanding, these are not our actual problems. Our actual problems are, what do homeopathic medicines contain? That is our problem. What efficacy each homeopathic drug actually has, that we need to find out. That is our problem. What is the mechanism of action of every effect that homeopathic medicines possibly can give? That is the problem that we have. We do not know anything about that. Our problem is the reliability of the homeopathic medicine data. We have taken for granted that our entire Mater Medica is like a holy Bible. It is not. Homeopathic Mater Medica is full of junk material and incomplete, unscientific information. We need to separate them from the real information, because we have not done drug proving all over again. We are believing and trusting the drug proving which was done 150 years back, and nobody has ever repeated the drug proving. And lastly, but not the least, most of our medicines, or many of our medicines, are not reproducible. We are still relying on the medicines which were made 150 to 200 years back, and we are still following them by preparing them again from the back potencies, which have been not tracked. They have been received from one pharmacy to another pharmacy over last 200 years. And in 200 years, we had 2 world wars. I always wonder, how did these back potencies ever survive these world wars? So these are some of the questions that we have. We should learn to ask. The next point that I have to share is over mentalized and philosophized. We have mentalized homeopathy a lot, as if homeopathy is all about mind and emotions and mental symptoms and mental personality type and all. We have turned homeopathy more into philosophy than science. Primarily, homeopathy, in my understanding, is a science and it is not philosophy. Philosophy is just a way to understand certain aspects, but fundamentally, homeopathy is a science because it is based on the law of similars, which is nothing but a biological phenomenon and the physics phenomenon of hormesis. And it is using potentized medicines, which is also a lot of science behind that. So homeopathy has to be made more scientific than just philosophical. The next point that I would like to share is a quote by one American mentor. It says, "What has brought us here will not take us there." It means whatever belief that we had about homeopathy for 200 years, if we remain stuck to that, that is not likely to take us to the next level. If you want to really grow and evolve as a science, we will have to change our approach, look at homeopathy more scientifically and not just in a rigid manner. Next point that I would like to say is that learning for failures. One of my major learnings comes in homeopathy is a large number of failures that I have in the practice. At Life Force, we treat good number of cases. For example, if we are talking about nephrotic syndrome, we might have treated 300-400 cases. Ankylosing spondylitis, 700-800 cases. Lichen planus, maybe 10,000 cases. And when you treat a lot of cases, there are a lot of failures. And when there are a lot of failures, then there is new understanding which appears. One of the understandings that I developed seeing a lot of failures is that there is a need for new drugs in homeopathy. Most people did not realize this. We all remain very happy with whatever medicines that we have in the Mater Medica, but then that is not enough. We need to introduce new drugs because there are new opportunities in inventing new drugs, and there are new diseases and complicated diseases. I think we must explore much more on new drug discovery. That is one of the areas of my interest, as many of you know. There's a need that we need to re-engineer homeopathy. Homeopathy has become static and it has become stagnant in my views, which are slightly bold. In last 100 years, around the time of Kent and subsequently, where the allopathic science or the conventional medicine and other sciences were growing very rapidly, homeopathy did not grow at all. Homeopathy became more philosophized and we stopped our growth. Only in last 20-30 years, there has been some research and newer understanding about homeopathy. So I strongly believe that homeopathy requires to be re-engineered. Next and very important point is about prognosis. Many of the homeopaths do not have clarity about the scope of treatment. They believe that if the drug is right, it can cure every disease. That is not the truth. They believe that if the mentals are matching, then it can cure the disease. No, it is not so. Homeopaths, I've seen having lack of clarity. We need to have clarity about the prognosis of diseases. And it is also very important for the ethics point of view that we have clarity about the treatment scope, and we should be able to share this information very clearly with the patients. So this is one of the areas which especially young homeopaths must learn in their early life. No room for rigidity. This is one of my thoughts, that we don't need to be rigid. We have seen homeopathic doctors, homeopathic teachers becoming and remaining rigid about their philosophy, their belief systems, their concepts, and so on. Homeopathy, at the end of the day, is an empirical science, and there cannot be rigidity and fanaticism about empirical science. Single remedy, single dose are all fantasies that we have. We have to outgrow that. There's a need that we review the homeopathy in the light of current science. Too much of emphasis is being given on mental symptoms, which is also in reality is not true because of various reasons. One of the reasons is that in the drug proving itself, we do not have clear ideas about the mental symptoms and their accuracy. Classical homeopathy is another, I would say, point which we need to debate. Hahnemann himself never used the word classical homeopathy. Classical homeopathy is a hype, and we need to really rework on this understanding, and we should debate on this. Last but not the least is we need to be humble. Homeopathy and homeopathic doctors work with a lot of challenges. We have very limited knowledge about the human system at the first place. We have very limited knowledge about homeopathic medicines. We have very limited understanding about how they work, what they are capable of doing. We have practically no idea about the mechanism of action of homeopathic medicines. With all this scenario, how can we be arrogant? How can we be rigid about anything? We need to be very humble. And as I have a habit of adding extra points, I would like to add one more point, and that is, can I, wait a moment, why has this disappeared on my screen? Take just 1 second, please. अभी थोड़ी देर पहले से हुआ था. I'm still busy. Okay, so last point is that after having spent 45 years in the learning of homeopathy and in various areas, I would like you to consider me as a resource for homeopathy. I'm here to share my thoughts, my whatever little understanding I have. I'm always ready to share and give it to the profession, to the students, practitioners, institutions, policymakers, researchers, etc. So feel free to use me as a resource because I'm all available. Thank you so much for listening to me. We will also quickly launch one video as a part of this series. And this video is on simillimum, myth or a reality. We'll just click on this and show you a small part of the video clipping. Rest of it, you can see it on YouTube subsequently.
Sir, in our practice as homeopaths, we often struggle in selecting the simillimum, no matter how good the case taking be or the repertorization. So I want to know from you, what are your thoughts on the concept of simillimum?
This is a good question, and I would love to answer this, but I believe that my answer might trigger some debate, and it may not be very pleasing to every homeopath. But I'll be very honest with sharing what I think about the simillimum. As I recall, simillimum is defined as probably the homeopathic medicine which is prescribed on the basis of the most similar homeopathic medicine, which is prescribed on the basis of the totality of symptoms. So before I go into the definition and take it from there, I just would like to share a couple of things. Once I was searching through the organon of medicine, and I found that Hahnemann did not use the word the simillimum in the organon of medicine 6th edition. This also reminds me that in the year 1985 or so, we had organized one seminar in Mumbai where we invited 5 of the most leading homeopaths and teachers from different parts of the country. And in that seminar, we brought them some 3 or 4 cases and requested them to take the cases and prescribe. And we observed that for all the cases, almost 4 or 5, these 5 senior practitioners, they took the cases sincerely and they came with 5 different medicines. And that made me think even that time that how can there be 5 simillimums for a given patient? So yeah, that was a small glimpse of one of the videos, and we have many more such videos which I would invite you all to have a look at as and when they are released. They've been prepared with a lot of care and intent. So with these few words, I think it's time that I would thank everybody. I thank all the speakers who joined on my request this particular webinar at a short notice. I also thank all the participants from almost 15 countries. They participated to celebrate this 40 years event, and we hope to have some more events if there is interest. And I must also thank my entire team, with my team of IT, consisting of Dr. Amrita, Dr. Neetu, Vikas, Chaitanya, Yogesh, and many more. They all have been working very hard to make this series of 400 plus videos over the last few months. And thank you so much. We will also continue talking in the WhatsApp webinar community that we have developed. I think many of you are part of that. Some of you might not be a part. You can add yourself to be in that group where we'll share. We'll also have some small questions, answers if required. If there are some questions from the participants which we could not undertake here, we'll try to answer them from the respective speakers. And with these few words, I thank everybody once again and wish you all the best. Have a great evening and have a great day in other parts of the world. Thank you so much for being here with me to celebrate this particular occasion. Have a great day. Take care of yourself.